So I think they're looking for a valued, sustainable, value for money, quality is paramount, obviously, service that can be transferred across different long-term conditions, not just chronic kidney disease. So I think they're looking for basically a block delivery of a service framework, which we've got clear KPIs for, and also meets their local priorities as well. I think it's important that you work in partnership. It's not about working in silos and each having, the secondary care or the provider having a completely different set of objectives to the CCG. You have to be working collaboratively and in an integrated way.
I think the commissioners were looking for an area that was clinically relevant, where there was opportunity to make a difference. I think with the CKD project, there were twofold. One was there was an opportunity to increase the known prevalence. The other side was there was evidence emerging from Camden that by having this sort of clinic, you could reduce significantly the number of outpatient appointments, which obviously has cost implications.
So I think it is important to have that discussions early on with the commissioners to understand the need for such a clinic, especially a virtual clinic, having two specialities working together. I think from our experience, because this clinic was set up much early on, before the CCGs evolved, it was much easier to talk to the primary care team at that time. But I think it is, if you're setting up a clinic now, it is important to have that early on discussions with the commissioners.
So with our experience, we focused a lot on pre-launch of the service, sort of engagement events, a lot of questions and answers with GPs, with CCGs, with other long-term condition providers as well. And we basically, it was really important to make sure we had a shared goal, that they were on board. And I think whatever's their local priorities is obviously our local priorities, because we're serving the same population. So a lot of winning hearts and minds, really, and sort of making sure that they're on board with our KPIs and what we're intending to do. It's really important as well to sort of agree the shared records and all the sort of data governance issues at the very beginning, because otherwise then later when you're trying to do your searches and get some patient level data, it's impossible to do that. So it's really important to be clear at the beginning whose responsibilities are to collect what.
So we were quite fortunate in that we've always in East London had very close working relationships with our commissioners, particularly when I started off with the diabetes service. So we have regular working groups and a partnership board and an outpatient transformation program happening here for a long time. So we were able to work with the people who routinely attended these, and they were all chaired by commissioning leads, so we were able to take our idea to them.
But I think it is important to have that discussions early on and convince them the need for that clinic. So there are several advantages of having such a service. So one, reduction of face-to-face clinics. Second thing is actually dealing with the problems early on and delay the progression of their renal disease by actually ineffective, saving money long term. And from a patient's point of view, I think it's important because it reduces the morbidity and mortality of patients.
The top ones, I think, was making sure you get your IT sorted and your integrated IT, because otherwise, if you can't access the patient's historical data, then you won't be able to do an effective triage or an effective non-face-to-face clinic encounter. So it's really important to make sure that you've got representation early on from EMIS or whichever software they use, and GPIT from the CCG, so that they're involved and everybody's clear what searches are going to be developed, so that then it doesn't make data collection cumbersome and you can easily get the information you need to demonstrate the worth of your service.
I think it's important to share your enthusiasm and explain why you're enthusiastic about something. I think if you're arguing from the patient's perspective, it's a very hard argument for them to argue against. So I think that's always a good starting off point. I think if you are arguing against secondary care referrals again, or something that will reduce cost to the system. Again, that's a very strong argument. If you're not meeting those tests, then why else are you doing the service? So they're quite good questions to ask yourself as well as trying to persuade commissioners to buy in, as it were.
There are pre-existing relationships, then make sure that you build on them, and it's part of the whole process of looking at the whole pathway and looking at how best you offer care. This is just one tool around how you offer better care for people with chronic disease, for example. Involve them very early on, make sure you work jointly to establish what your outcome measures are. I think it's really important to work very closely to define your outcome measures, your targets, how you're going to achieve this. If you face an obstacle, then try and deal with it jointly rather than just try and patch it up on your own.